So as we've been talking about, it's clear that massage and body work are becoming more and more integrated into how people think about healthcare as a whole.
Yes.
Do you feel that the current slightly hodgepodge approach to integration is adequate as far as massage therapists working more with the established Western medical community? Is that adequate, or is there another model that you think would be more useful to help that effort along?
I don't think it's adequate. As many of us are learning in our life, we need to focus our intent and be clear about where we're going. This hodgepodge approach, it's working in pockets, but it's not really solidified. So another model would be for us to, I guess, start and think about what it used to be back in the early part of the 1900s. I just realized this, I just learned this, is that the art and science of massage was studied by physicians in medical school. Thanks to the work of Metzger, we've all heard of him. But that's one of the things that he did, is he brought the study of the art and science of massage into medical schools. However, as this century, as 1900s progressed, that got lost, as we know, when antibiotics and right around World War II, when all this medical technology infatuated our society. Okay, wouldn't it be amazing if the art and science of massage were studied in medical school? Wouldn't it be a wonderful tool for physicians to have? And wouldn't it be great for society as a whole, for the consumer, and for us? And massage would be more accessible to everyone.
Well, and studies show that a lot of the reason people don't access massage, acupuncture, a lot of the alternative or integrative modalities is because there isn't physician support for them. They ask their doctors, or they tell their doctors, I get a massage, and there's a lot of doubt there about the benefit of that. And so...
Right, and we have to remember too how still in our culture, how dependent society people are on their doctor. They're an authority that stands way above. If the doctor says massage could help you, I'm not talking about replacing medical care.
No,
not at all. Massage could help you. Whatever you say, yes. I mean, the potential is huge, and we've come a long way, but I feel we've just barely scratched the surface in this discussion.
Yeah, and we talk about that a lot, about because I think a lot of people think that maybe that's the doctors or the Western medical profession, that responsibility for reaching out or for learning about this is entirely their responsibility. But we really feel that that's our responsibility as practitioners to reach out to them and make that accessible and make it easy to access. And we are the same ways in our practices. It's very time-consuming and difficult to learn about something that you don't already have some familiarity with. Sometimes we don't even know that we need familiarity with it. And I think, I suspect that it's the same way in the community that we're talking about reaching out to. And so,
yes, that's a good point. We need to make it very easily digestible and be able to be assimilated. Yes.
Why don't we reach out to MDs more often?
I think the beginning is to really ask that question. What are the obstacles? How do you feel when you ponder the thought of approaching a medical person? I think we may feel the same way. We've got them up on a pedestal. There are stereotypes, okay? They don't care about it, but doctors do. They are suffering as well in this current model. They are finding that they are not able to help their patients. They are feeling frustrated with the whole insurance and the whole model. I mean, we know this one-on-one, so maybe we can rehumanize them.
Right.
Right? Because isn't that what's happened? That's one of the things we talk about in medical anthropology. is that powerlessness we feel when we go to the doctor. And don't we talk a lot about that? Empowering our clients, right? And maybe we can think about that. How can we empower ourselves to rehumanize the medical community and just approach them and realize that they are feeling the same frustrations, maybe even more. I mean, their burden of responsibility is huge. Yeah, walk in your shoes a little while. That might help us.
Yeah.
And just do it.
Yeah. So in order to, so moving on to a little bit of a lighter note, in order to, and actually, you know, when I wrote this question, I envisioned it as a kind of utopian society in which everybody receives massage fairly regularly. You know, what are the essential things that we need to know or do in order to achieve that?
Yes. Well, I think what we've been discussing is really a big part of that, to become solidly integrated into the medical model. You see, we've been out on the fringe, haven't we? As, you know, first we were pampering, you know, then we moved to relaxing, now we're preventative. Could we be part of remedial care? No. Well, so that would be essential. But there's something else that always comes back to my mind. The people who work on injuries and very, very medically, so to speak, have forgotten maybe the great power of touch. And if we can remember that amongst ourselves, and society knows that just if I put my hand on you, all kinds of things are going to happen in your body that are healing. And the huge power of simply being there and touching, maybe even only touching through eye contact, if that's all that's possible. And if we could all remember that and educate our clients in that way, educate the public, not just our clients, I think we might get closer to that society where massage was our life's regimen for our health. And we're in a great time of change, the way our society's even thinking about health and illness and healing. So we're at a good time, and also as financial resources go down, our creative resources rise. And it's time to focus our intentions and ask ourselves, what is missing, what is needed, where are we stuck?
Well, thank you so much, Debbie, for your time.
Thank you.
It's been a pleasure interviewing you.
My pleasure.